Good afternoon and welcome to Affordable Medicines Are Still Elusive. America's Families Want Fair Prices. This is our virtual discussion on what can only be described as a mandate from the people in America for relief from the high cost of prescription drugs. Good afternoon, I'm Kimberly Aline, Senior Director of Communications at Families USA. A huge thanks to all of you for joining us today. This conversation is being brought to you by the West Health Policy Center and Families USA. You know, in our work at Families USA to reduce the high cost of prescription drugs, we are very fortunate to partner with organizations like West Health Policy Center and also many consumers and families across the country who also are incredibly dedicated to lowering the cost of healthcare and advancing sustainable, high-quality healthcare delivery models with the potential to improve care for America's families. Before we get started, I need to share a few quick housekeeping items. First, today's presentation is being recorded, and we will share the slides and recording on our website at familiesusa.org. And if you have a question, please type it in the chat box at any time, or you can raise your hand when we open our Q&A session. So with that, we are all well aware that even before the COVID-19 pandemic, so many families across the country were struggling to make ends meet and make difficult trade-offs between paying for basic needs and unaffordable medicines. These life-altering trade-offs are even more challenging now as we find ourselves in the midst of a global pandemic, combined with an economic crisis that we haven't seen one similar to in generations. And so we have learned in story after story from our consumer friends and in survey after survey that people are clear in their call for affordable medicines. Today, we will share new survey findings highlighting voters' priorities around reducing the cost of prescription drugs. We will hear from a consumer who is managing unaffordable medicines, and we will also hear from the Honorable Representative Anna Eshoo of California's 18th District and Chairwoman of the Powerful House Energy and Commerce Health Subcommittee. But first, we're going to hear from Gils Story of Menlo Park, California, about her personal struggle with unaffordable medicines and her strategies to manage what is a really difficult situation. Now, Gail could not join us today in person, but we spoke with her earlier, so let's listen to part of her message. And we can play that video clip now from Gail.
And so primarily for your asthma medications, you've been using a Canadian broker for at least 10 years or more?
Yes.
If we're thinking about affordability and if you were talking to Representative Eshoo, what would your message be? Because I know you've had to take some pretty extreme measures in order to help manage your, basic living expenses.
Well, yes, I do rent rooms to Stanford students. However, I did lose a tenant at the beginning of the pandemic, so my income's gone down. The rent on the remaining room has gone up over the years, so accidentally I've benefited from the extremely high cost of housing.
But if not for that, is it fair to say you would have a greater struggle financially, including with your prescription drugs?
Oh, definitely. A lot of little luxuries, things like travel and movies and restaurants, and a lot of those things I would either have to stop or do differently. I would have to watch my budget a lot more carefully.
Some might say you're having to manage the high cost of prescription drugs by getting medicines from across the border from Canada. And that's really quite a compelling situation to find oneself in. And it really gets to the root of how egregious the policies here in the US are regarding prescription drugs. So to that point, what would you say to Representative Eshoo about this issue of high and rising prescription drug costs?
Well, it's unconscionable. Big Pharma, they spend more on advertising, as far as I know, than they do on anything else. They obviously don't care one whit about Americans. And by the way, other countries also do research, also make discoveries, and they don't do this to their citizens. in the other, advanced industrialized countries.
Okay, so we just heard from Gail Shradanovic from Menlo Park, California, explain how she is managing high prescription drug costs. Now I am so delighted to introduce Congresswoman Anna Eshoo. Congresswoman Eshoo represents the 18th Congressional District in California, including the Menlo Park area where Gail is from. And she is chairwoman of the Powerful Energy and Commerce Subcommittee on Health. She's a longtime, very passionate champion for consumers and an important advocate for the Elijah Cummings Lower Drug Costs Now Act, which passed the House in 2019 and would provide critical reforms to lower the cost of drugs for families across the country. Welcome, Chairwoman Eshoo. We are so honored to have you with us, and thank you for joining us for this incredibly important issue.
Well, thank you, Kimberly. It's wonderful to be with you, and I thank Families USA for asking me to participate today. So I'm delighted to be with you on really one of the most important issues that faces the American people. We heard Gail's story, and her advocacy and the stories of advocates across the country are essential in this battle to really move away from the broken system that we have today. Now, excuse me, in 2018, the American people gave us the mandate by putting the Democrats in the majority, and it was really all around health care. It was about the cost of prescription drugs. It was about saving and strengthening, protecting the Affordable Care Act. And so in January of 2019, as I took over the Health Subcommittee, which is an enormous honor, the first woman in the history of our country. It takes time for women to get there, to chair the subcommittee. Now, empowered by the mandate that the American people gave to us, we passed landmark legislation. It was HR3. And by the time it got to the floor of the House, we had lost our beautiful colleague, Elijah Cummings, and we named the bill after him, Elijah Cummings Lower Drug Costs Now Act. Now, this is a historic bill, and I say that because it was the biggest change to Medicare since the program became law in 1965. It allows Medicare to directly negotiate the price of the most expensive drugs in our country. Now, why did we have to do that? Because the law today prohibits direct negotiations between Medicare and the pharmaceutical companies. And this is something I've been working on to change for over a decade, along with certainly Families USA. You've been out there well over a decade on this issue. So the House passing H.R. 3 is a major step forward. But of course, we need the Senate to do the same, and we need an administration that understands the needs of the American people and a president that will sign this into law. Now, I know that this is something that I hear from my constituents on a consistent basis. Many have asked me, why direct negotiations? We already do that today with the VA and in TRICARE, which is the healthcare system for our military and their families. Now, I've represented the district now for 28 years, which is hard for me to believe. I have never had a veteran complain to me about the price of their prescription drugs. Not once. Not in email, not anyone in person, not in meetings in my office, not in telephone calls. So we know that it's working, and it is sweeping, and it would be, I think, singularly the most effective way to bring down the high cost of prescription drugs. Now, my subcommittee passed many reforms, some of the really shady things that the pharmaceutical companies were doing, and those were important bills. But this is the mother of all bills, to allow Medicare to directly negotiate, as they do today, with the VA and TRICARE.
Thank you for that, Chairwoman Eshoo. I wanted to talk a little bit about Gils Story in particular. So you heard a bit about her challenges.
Did, yes.
Just tremendous fortitude in pursuing solutions, and also her perspective on the larger problem of a high and rising drug costs. What would you say to Gail and other consumer advocates like her?
Well, I think that number one, and it's such a source of frustration to my constituents and people across the country. When I tell them what we have done, that we heard them, we know what this issue is, we know the hardships that are involved, but that what we send over to the Senate sits in the bottom drawer of the majority leader there, of Mitch McConnell. So for all of the advocates, everyone that is affected by this, and I don't say this to be partisan, it is simply a fact of life. We need a Senate that is changed by the American people, its composition, so that we can get this across the finish line. They simply don't, my Republican colleagues simply don't believe in this. They fought it in the subcommittee, they fought it in the full committee, they fought it on the floor of the House, but the American people gave us the majority. We passed it. We need a new administration and a new Senate. And, the stories that I hear are really heartbreaking. Just last week, I had a virtual meeting with the juvenile diabetes parents, and there was a little boy with type 1 diabetes on the line. And listen to this story. His friend at school, his father had died, and he died from rationing insulin. Now, this little boy and his mother were meeting with me, as I said, virtually, and asked that we keep working to lower the price of life-saving drugs like insulin. And what I'm so struck by is the following. Of all the advances we've achieved for, in this case, for type 1 diabetes through the research that Congress funds at the NIH and the Special Diabetes Program, this little boy wasn't thinking about those new treatments. He was worried that one day he might have to ration his insulin like his friend's father. So, these are the stories that really that people are living out every day.
Right.
No one can say to any of the advocates, including this child, that you don't know what you're talking about. This is what people live through every day. And that's why it's absolutely essential for us to keep the pedal to the metal and that the American people will choose a new pathway forward so that we can get this over the finish line and that they won't have to do what Gail is doing, whether she ends up renting a room or can't rent a room, and what her income is, and then have that affect what she can afford at the drugstore. I think she used the right word. It's unconscionable.
Right, exactly. That's right. And my final question for you is, and I know you have to run, but just on the topic of consumers and what they're saying and what you're hearing, we have heard from consumers that they are very afraid that the cost of COVID-19 vaccines and treatments will be unaffordable, and that prices should be capped given how much taxpayer dollars have contributed to their development. Can you share how Congress is acting or will act on these concerns?
Yeah, no, I'd be glad to. And that's also a question that many constituents are asking as we hope and pray for an effective and safe vaccine. The House just passed, just a few days ago, last week, the updated HEROES Act, and that eliminates cost sharing for COVID-19 vaccines and treatments. So for people who are uninsured, that legislation offers states the option to provide coverage for COVID treatment and vaccines through Medicaid. And the bill was a compromise offer where we came down in top-line costs, but we still kept the coverage for vaccines because that's a absolute top priority. The goal has to be that, A, that the vaccine is scientifically proven to be safe and effective. And I spent the last several months, just in the trenches fighting the administration for transparency and to make sure that this interference with the scientists doesn't advance. So the process has to be transparent. The vaccines have to be affordable, and we have to have an equitable disbursement of the vaccine across the country. Now, with over 200,000 of our fellow Americans who have been claimed by this virus, I would say that our country cannot afford an unaffordable vaccine. People have to have trust in the vaccine, but it's their ballyhoo that we have one, and I'm the first one in line for that. If it's not affordable, if it's not equitably distributed, we will not have really fulfilled the trust that the American people have placed in us. So I'm very pleased with the legislation, but again, we need the administration and the Senate to agree to what the House passed, and what I just described is in it.
That's right. That's right. Well, we're certainly watching. All of the America's families, for sure, are watching and waiting. So we too are hoping and praying that something will pass soon to take care of them, because, as you said, it's all about the consumer.
Well, I just, I think that some of the seniors, especially, are confused by what the president said and signed an executive order and all of that. I would quote Speaker Pelosi on that, where she said, it's not worth the paper that it's written on. And it's gimmicky. It really does not, the orders are superficial, they're non-binding, they're full of unknowns about how the policies will actually be implemented, under what authority, and when. We need laws, not executive orders. And bringing down the cost of prescription drugs is a must. And HR3, I maintain, and I think that my colleagues, Families USA, and advocates across the country understand that very well.
Well, Chairwoman Eshoo, I know that in your nearly 30 years in Congress, your platform has always been to defend consumers and call for better health care for America's families and to drive innovation. So we thank you for your service, and we thank you for stopping by today to join us.
Well, you're very kind, and I certainly appreciate being invited. And I want to thank your executive director, Frederick, because he has been a frequent testifying at my health subcommittee. And he always knocks the ball out of the park.
Yes, he does.
Because he's speaking directly to the American people. He represents the advocates, the consumers, the stories, the real life stories of people across the country, and just superb testimony and advocacy. So I'm very grateful to you as an organization, to Frederick, his leadership, yours, and everyone involved. So I'm hopeful that we're going to usher in a change of direction in our country, not for a political party, but for the American people, so that we can get this job done.
Indeed, indeed. Chairwoman, thank you so much again, and we can't thank you
enough. Thank you, Kimberly. It's wonderful to be with you.
Likewise. Thank you.
Okay.
Bye-bye.
Bye-bye.
Okay, friends, so you just heard from Chairwoman Representative Anna Eshoo from California's 18th District. Now we're going to turn back to Gail, who is actually one of Chairwoman Eshoo's constituents, and we're going to hear more about her experience with affordable medicine. So let's cue that part of the video up from Gail.
I'd like to know, since this conversation is specifically about high and rising prescription drug costs and how they are nearly uncontrollable, what your experience with unaffordability as it relates to prescription drugs has been, and some of the measures you've had to resort to.
Prior to Part D, I had prescription coverage, but the rules were written in such a way that I felt, I think that when that insurance went away and I was more or less forced into Part D or nothing, so I signed up for Part D. In the beginning, the early years of Part D, I worked very hard to stay out of the donut hole. So I ordered the majority of my prescriptions through Canadian brokers, two of the most expensive drugs for my asthma.
And what drugs are those?
Oh, there's Spiriva and Symbicort.
So they're so expensive stateside that you have to go through a broker so that they're affordable to manage your.
Well, the monthly cost when I order them from a broker is less than the copay in this country. And every time I buy one of those, it takes like $300 or $400 out of my annual benefits. And at least in the early days, I made the calculation that it was a much better idea to get them, even if I paid out of pocket. And in fact, why not? If the payment out of pocket is no more than the copay in this country, why not get it from there? Yeah,
absolutely. You mentioned that the two asthma medications that you get through the Canadian broker are cheaper than your copay in the U.S. What is that copay amount?
It was somewhere between 35 and 45. Fortunately, I don't have to use insulin, which I understand is off the charts.
It is. It is. And thus the stories about rationing insulin and deaths from rationing insulin. Gail, thank you so much. As always, it's so great to talk with you, and we really appreciate you stopping by to share your story with us, and we appreciate your advocacy. And so on behalf of the entire Families USA staff, our leadership team, and our board, we say thank you, and we hope you'll continue to fight and to advocate for better reforms, or for reforms, period, for high and rising prescription drug costs. My name is Kimberly Aline with Families USA. Thank you for watching.
So we just heard again from Gail Shradanovic, a constituent out in Menlo Park, California. So I was struck when talking with Gail that her costs to get her asthma medications from Canada are cheaper than her copay. And part of the video that we were unable to show due to length, I asked Gail if she ever had concerns about quality or safety of drugs, and it just came through loud and clear that the cost savings were, her greater concern over safety or quality. So that's just, as she said, unconscionable that this is a predicament she finds herself in. So with that, next, I did mention earlier in the call that we have new survey data, and we'd like to share those compelling survey findings with you. And these findings further highlight how people across the country feel about high and rising prescription drug costs. It is my pleasure to welcome Jeff Guerin, president of Heart Research Associates. As part of a very distinguished career, Jeff has undertaken landmark policy and communications research for many of the nation's leading foundations and educational institutions on topics that include global health and development, school reform, college affordability, healthcare reform, and global climate change. His clients include the Bill and Melinda Gates Foundation, the MacArthur Foundation, Harvard University, the College Board, and Families USA. He also has conducted reputational and policy research for leading trade associations in healthcare, finance, and housing. Jeff, thank you for taking the time today to walk us through your findings.
Sure, thanks for including me, and good afternoon, everybody. This is the results from a innovative survey that we conducted for Families USA in June, where we interviewed a representative national cross-section of 1,203 voters, so representative of the registered electorate, where we both surveyed them about healthcare issues with a particular focus on the cost of prescription medicines. But because we conducted this online, we were able to get respondents' reactions to a series of videos where people told their own stories about their experiences with high drug costs, trying to understand the impact, how people hear those stories, how they receive them, what impact they have. And as part of that, we looked at how pro-consumer stories stand up to similar kind of videos that pharma has put out, arguing kind of the opposite side of the case. So with that, let me take you through our findings on the next slide. So what you'll see very clearly is that voters at a very high level put a significant priority on Congress doing exactly what Congresswoman Eshoo said, which is taking action to address high drug prices. And there is overwhelming support, almost unanimous support actually, for legislation to give Medicare the power to negotiate with drug companies for lower prices. So the core idea in HR3 is broadly and intensely supported by the public. There is a view among a large majority of Americans that drug companies charge unreasonably high prices for their medicines, and that that has a real consequence, that many Americans face difficulties in affording the cost of prescription drugs. You'll see that a large, a significant minority of Americans say they personally experience the problem of high drug costs. And with regard to the development of COVID vaccine, you'll also see very briefly that there is overwhelming support across party lines for capping any out-of-pocket costs for consumers to get the vaccine. So that's what I'm about to tell you. Just so you know, the sample was, as I said, reflective of the public overall. You'll see that some of these results are very lopsided in favor of governmental action. It's not because the sample itself is lopsided in its partisanship. 43% of the respondents in our sample describe themselves as Democrats, 38% as Republicans. So that 5-point difference is about the average for national polls on self identification on a political party. So, and you'll see that the results are on many of these questions are far beyond that 5%. On the next chart, early in the survey, we asked our respondents about the importance for Congress to address a variety of topics related to healthcare and the economy. And you can see that at the very top of this list, 86% of voters say it's either very important or fairly important for Congress to pass legislation this year to reduce prescription drug costs and to stop excessive drug prices. That includes a majority of 58%, who describes that as very important. It's on a par with a few other things in terms of that high level of voters saying it's very important. It's on a par with expanding coronavirus testing, expanding access to affordable health coverage, and above other things that some related to the economy, infrastructure investments, cutting. You can see that cutting taxes on individuals and businesses are relative to everything else, a much lower priority and with much less intensity. And in the drug space, obviously, we don't believe there's an inconsistency between reducing prescription drug costs and increasing investments in prescription drugs. But you can see that more people think it is important to reduce drug costs than it is to ensure investments. And just looking at the percent who say it is very important to do these various things, you can see that it's not just a majority of Democrats, but a majority of independents and Republicans who say it's very important for Congress to pass drug price legislation this year. So on the next chart, we asked people both about their personal experience and their perception of the experience for most Americans. And you can see here that 37% of all respondents say for them personally, it's either very difficult or somewhat difficult to afford the cost of prescription medicines. 37% of all Americans in a country of over 200 million adults and over 320 million people we're talking about an enormous number of people who personally have this challenge of affording their prescription drugs. 14% say that it's very difficult for them. And even that, if you do the math on how many millions of Americans we're talking about when you talk about 14% of all voters saying that they have a very difficult time affording their drugs. And then there is a very broad perception that this is a problem for even if it's not for themselves, for many other Americans. In fact, 3/4 of voters say it's difficult for most Americans to afford the cost of prescription drugs. And you can see that voters of color, particularly Latinx respondents, are more likely than average to say it's a personal challenge for them. And even though we don't think of young people as necessarily as a part of the population that uses healthcare and takes prescriptions that frequently, because of their situation with insurance, they very are likely to say that it's difficult for them. On the next chart, we combine these two answers, and so there's 37% of the electorate who say that prescription drug costs are difficult for them personally, and then there's another 33% who say it's not difficult for them, but they think it's difficult for other people. and then 18% who say it's easy for me and easy for others. So that's a very small slice of the electorate who just don't see kind of much of a challenge here. It doesn't quite add up to 100% because there are some people who say not sure on some of these things. So that accounts for the difference. On the next chart, we asked about respondents' feelings toward the pharmaceutical industry today. And then we also asked about their perception of the amount that drug companies charge for prescription medicines. That overall, the attitude toward the pharmaceutical companies are more negative than positive by 39 to 33. You can see among Democratic and Independent voters, they both lean significantly on the side of having an unfavorable opinion. Republican voters are different and tend to lean toward the more favorable view of the pharmaceutical industry. But that notwithstanding, there is a kind of a very broad view held by 2/3 of voters that the amount that pharmaceutical companies charge for prescription medicines today is unreasonable. 1 out of 3 voters say they're very unreasonable, which is the darker part of the line there. And while Republicans in general may have a kind of more favorable and unfavorable attitude toward the industry overall, you can see by 62 to 38, even those same Republican voters say that the pharmaceutical companies are charging an unreasonable amount for prescription medicines. So on the next chart. When we asked about the impact of coronavirus on their feelings about prescription drug costs, nobody say that it's made it less important, but about half of all voters say the situation with coronavirus has made the issue of high prescription drug costs more important to them. That's particularly true among voters of color, among younger voters, among voters of color, it's true regardless of age. It's really among white non-Hispanic respondents, really the younger half of that group who say that the situation with coronavirus has created even a greater sense of urgency around prescription drug costs. On the next chart. So we just asked voters about legislation to lower the cost of prescription drugs by giving Medicare the power to negotiate directly with drug companies for lower prices. The legislation would give people covered under other plans the benefit of lower prices, which is how HR3 is set up. You can see when I said it's nearly universal, we rarely get 95 to 5 responses on any matter of public policy. 5% who oppose Medicare price negotiations is much smaller than the percentage of Americans who believe that the earth has been visited by aliens, for example. So this is a kind of really an overwhelming result, and it's a result that we've gotten repetitively. We've asked this in other surveys as well with the same result, and it's not just that 95% favor it, but 61% strongly favor this legislation, and 73% of all voters both say that they support the legislation and that it should be a priority for Congress to pass the legislation this year. As Congresswoman Eshoo said, the House of Representatives has gotten that message, but the Senate under Mitch McConnell has not, unfortunately. And you can see that the support for this legislation really is bipartisan and crosses party lines. So we're above 90% favoring it either strongly or somewhat, regardless of party affiliation. And a majority of both independents and Republicans strongly favor it, not at the same level as Democratic voters do, but still, this is really kind of a remarkable result. Next chart. And the counter argument on this is that, by having excessive legislation and public policies regarding drug prices, that it's going to reduce the ability of drug companies to invest in the research and development of new life-saving medicines. So here we're kind of pressure testing the support for HR3, or the main provisions of HR3, by asking voters which is a bigger worry for them, that Congress isn't going to go far enough to lower the cost of prescription drugs and allow people, and in a way that would allow drug companies to continue charging excessive amounts, or that Congress is going to go too far and reduce the ability of drug companies to invest in the research and development of new life-saving drugs. And you can see that, given this choice, by 69 to 31, voters' big concern is not that, oh my God, Congress is going to do something that will reduce the development of new life-saving drugs, but that Congress isn't going to do enough to deal with the crisis of high drug costs. And you can see, even among, in the very bottom line there, even among the people who say, I don't even see this as a kind of a problem, they're a little more concerned that Congress is going to go too far than they are that it's not going to go far enough. I mean, they're evenly divided, but everybody else, whether they think it's a problem for them personally or a problem for somebody else, are worried about Congress not doing enough. And a majority of Republican voters, by 57 to 43, worry that Congress isn't going to do enough, not that it's going to suppress the development of new life-saving drugs. Next chart. So let me just very briefly say that we had respondents look at 6 different videos of consumer stories, kind of like the one you just heard here. Everybody saw one of those, plus a pharma ad where it's a dad talking about his concern, as we were just discussing, that the drugs that his children may need in their lives aren't going to get developed, and who can put a price on the life. And so, we wanted to know about the impact of these consumer experiences and stories that Families USA has been collecting and sharing, and it's really very much part of its model, and not just the reaction in an absolute term, but relative to the stories that the other side are trying to tell. And what we saw in our research is that these stories really do create a real sense of a connection, a kind of personal connection around these public policy questions. Our respondents really engage in these stories when people are talking about the challenges that they face in affording their prescriptions. Many of the stories we tested focused on insulin and what it's meant to them in terms of primarily their health care and their ability to kind of take the medicines that they're supposed to be taking when they're supposed to be taking of them. There's a real power to those stories, and that and when the conclusion of those stories is that Congress really needs to act, those personal experiences add an enormous amount of power to the ultimate conclusion about the importance of congressional action. So these stories really do matter. People are able to relate to them, connect to them, they're kind of, they react really empathetically and to the stories, and it strengthens the public policy takeaway. And on this question of, oh, if they see one of our stories or one of these pro-consumer stories versus the pharma dad, what happens? And it turned out just when we did the then follow-up questions, that ours versus one of ours versus one of theirs increases support for the urgency of passing prescription drug legislation, so that even though we're starting at a high level and we're letting the other side have its say against and much more highly produced video than we were sharing, people still move even more in our direction as they hear about these personal experiences of struggling with high drug costs and what it's meant in somebody's life when that happens. So it's we learned a lot from that research that we have been able to share with Families USA. Finally, on the next charts, you can go ahead. We asked people about setting a price cap on COVID vaccines that developed with federal funding. And by 88 to 12, that's exactly what Americans want to see happen, including 6 out of 10 who feel strongly about that. And people believe that this is really the federal government's responsibility to make sure that there's enough vaccine produced, and this is not something that ought to be left up to the pharma companies or up to the marketplace. There's other research we're doing that shows that there's actually a lot of price sensitivity to people's willingness to get vaccinated. And so this really matters in terms of not just in terms of compliance with a vaccine if and when we have one, hopefully sooner rather than later. So I think this is an important kind of real-time result as well. So I think that's it. And Kim, let me turn it back to you.
Okay. We're getting a little bit of an echo.
For me, or?
I can't tell. I think it's gone now.
Okay.
Jeff, thank you. I tell you, every time I am presented with this deck, I feel like I pull out something new each time, and there's so many compelling, truly compelling and surprising, I think, themes to pull out. I'll pause here for any questions from our friends on the line. Any questions for Jeff about the survey data?
This is Sandra chiming in. If you have questions, please feel free to put them in the chat or unmute yourself.
So I'll give it a minute in case someone is typing right now. But Jeff, I have a question for you, which is, I know I found several, as I said, surprising, takeaways. What did you find most surprising in this data?
Well, I'm not sure it's surprising because we do a lot of this research, and when you do what I do, it sort of takes a lot of the surprises out of life. But I think, I did not necessarily expect kind of Republicans to be as supportive of this kind of action at such a high level. Mm-hmm. And it's because there's such a disconnect between what the elected politicians in Congress from the Republican Party are saying and doing on the topic of Medicare price negotiations, and what rank and file Republicans want, and what they believe about prescription drug prices today. So that disconnect between the Republican politicians in Washington who are raising a lot of money from the pharmaceutical industry, and Republicans out at the grassroots level who are living with the problem of high drug costs, I think is really, a super important part of this research.
Mm-hmm. And I think the notion of, I was struck in addition to that point by the theme of empathy, you know, the large number of people who acknowledge that even if high drug costs are not an issue for them, that they know that there are others and that it's important to find a resolution for them. So that was.
And their policy views are almost the same as people who experience the problem personally.
That's right. That's right. So lots of good information in there. I see that we still don't have any questions, but we invite you to use that chat function in case you think of something. In the meantime, I'm going to turn it over to Sandra Wilkness, who leads our prescription drug affordability work here at Families USA, and she's going to give a few remarks on the broader landscape. Sandra, over to you.
Yeah, great. Thank you, Kimberly. And then I'll just have a quick follow-up question for Jeff, if I can sneak it in at the end around what you all were just discussing, which is so important.
Yeah.
And just in our remaining few minutes, I just wanted to bring us back out to the broader context for the discussion we had, the two discussions we had at the beginning of today's session, and then the data really rooting us in, you know, what we're seeing across the country with respect to people's perspectives on high-cost drugs. And so I'll just take a few minutes to really talk about the fact that these findings, those stories are really converging with a number of other findings and stories that we're seeing. It's really a strong message, a drumbeat, and some of this is even pre-pandemic, and of course has been exacerbated since we've had the multiple crises as a result of the COVID-19 pandemic, and of course resulting financial strain that people are experiencing. Would you go to the next slide, please, Natasha? Thank you. So just really quickly before that, I wanted to note in February this year, there was a Gallup and West Health partnership poll that showed that 2/3 of those surveyed across demographic subgroups and income levels reported that prescription drug prices have increased in their view since 2017. So it's really something that people are broadly aware of, as Jeff noted, even if they themselves are not personally struggling with those issues. And it is also taking a large toll on a large swath of people. This slide was actually is highlighting some data that was collected pre-pandemic. This was these are data from a Consumer Reports survey, also a national representative survey across the country conducted at the end of 2019. And you can see there, you know, what the impact has been. The findings that you see here are those that are from people who have indicated that their drug prices have increased. And for those people, there are a large number of folks who really are having to make very difficult choices around their own health care, things that are detrimental to their health and well-being, like not filling prescriptions, not visiting a doctor, and then also really having to tighten their belts. Look at the number of people who spent less on groceries, spent less on family, and using credit cards. So there are really very stark findings around the financial impact for folks. And of course, that has gotten a lot more challenging since the COVID-19 pandemic. And I'll just fast forward to May here and just highlight, for those of you I'm sure have seen it, there's a recent Kaiser Family Foundation tracking poll that found these trade-offs are embedded in a serious broader personal economic crisis. 3 in 10 adults say they've fallen behind in paying bills or had problems affording household expenses like food and health insurance on basic household expenses since February. 1 in 4 reported that someone in their household has skipped meals or relied on the government or charity food programs. And this number is higher among those households who've lost a job and income, of course, and among Black and Latino adults as well. So 1 in 3 people across the board. And people are worried that things are going to get worse. Just underscoring what Jeff has shared with us, there was another recent Gallup and West Health survey in May that similarly found that 9 in 10 people are concerned that the pharmaceutical industry will raise drug prices during the COVID-19 pandemic. So there's concern that that's happening, and this has borne out. In July, there were a number of reports that showed that pharmaceutical companies continued with annual routine price increases between January and June. at the same levels as previous years. So really sort of routine business as usual kind of approach here, even during the pandemic. And then in July, a number of prices raised again around some brand name drugs. And then finally, one analysis by the Patients for Affordable Drugs shows that a large portion of those drugs directly pertain to COVID-19 therapeutics, whether they're direct therapeutics or those that are adjunct or related to related conditions that are caused by the virus. So pretty stark findings, and I think speak to the fact that the concerns are real, and that people are asking for relief, and they're asking Congress to act now. And I would just finish my remarks by saying not everyone has the fortitude that we heard from Mr. Donovic. She's demonstrated over the years she's managing her drugs. There are very many people who don't have that either opportunity or that drive, and so we thank her for sharing her story. And I think most of the findings show that the most vulnerable people are getting hit the hardest. Those are just a few reflections to kind of bring us back out, broader Zoom. And I see that we might have one question here in the chat. Kimberly, I'll go ahead and read it out since I have my mic off. One question for Jeff. Attitudes toward pharma don't seem as negative as I would have thought. Does that lead you to think messaging should steer away from anti-pharma horror stories, for example, price gouging, CEO salaries, etc., and toward patients' tough choices? Is there a downside to anti-pharma stories?
I don't think there's a downside. It's just a question of what approach is more impactful, whether the reason to lower prescription drug prices is that pharma is not only making out like bandits, but acting like bandits, or the reason for action is that there are millions and millions of Americans who are really struggling and suffering under the burden of their high drug prices. The two things aren't mutually exclusive, and we think there is definitely impact in talking about the ways in which pharma is making out like bandits and acting like bandits. But at the end of the day, if you had to do one thing, the thing that is most motivating to people and speaks to the urgency of action is the reality that millions and millions of Americans really struggle with the challenge of high prescription drug costs. And telling those stories in the very personal way that Families USA has become so expert at.
Thank you, Jeff. Thanks, Tim, for the question, and thank you, Sandra, for showing those findings. They really do just further elevate everything that Jeff found when he was in the field. And Sandra, you said you had a question for Jeff as well.
Yeah, I see we're out of time, but I'll be super quick. And it's really about this relatability and this sense of community. And I was really struck by the findings of, even if people aren't struggling themselves, that they're really concerned about others. And I wonder if you could take just a minute to talk about the demographic differences that you had noted in that slide about who's struggling themselves and who's really thinking about other people struggling but don't feel like they themselves are.
Well, I mean, you could see that from that chart that voters of color were a little more likely than average to say they struggle with the problem of high prescription drug costs. Seniors, because many of them have Part D coverage, or a little less likely to do so. But in the video test that we did, Sandra, we showed the videos were of we tried to make the speakers diverse to see whether how the empathy and relationship worked across those kinds of lines there. And we did find that the story, even if the story is coming from somebody who looks different from you, if these stories of people not being able to take all of their medicines, having to cut their medicines in half, having to skip doses and put their health at risk. Those are very relatable, even if the person who's telling that story doesn't look like you or doesn't come from the same background as you.
Thanks, Jeff. I don't think there are any other questions, and this has been such an incredible discussion. I really hate to end this, but we are at time. We've reached the end of our time together. Thank you, Jeff, and thank you, Sandra. I know our audience appreciates this conversation we've had today. At Families USA, we're dedicated to creating a nation where the best health and healthcare are equally affordable and accessible to all. A special thank you to our friends at the West Health Policy Center for partnering with us to make this vision a reality. And to our audience, on behalf of us all at Families USA and our friends at West Health Policy Center, thank you for watching and joining us today. Please stay in touch with us at familiesusa.org. A reminder that the recording of this conversation along with the deck will be on the website there at familiesusa.org. Until then, take care everyone and stay safe.